hello, and welcome back to another ASMR video. This is the Dance ASMR, and today I'm going to be studying for my NREMT state test, which is on Wednesday. And I thought it's been a while since I made a video, so why not just record one, talk over it real fast, and then after that, I'll just post it to my YouTube, because I haven't done that in a while. So, welcome back to my channel. Let's get started. During transport of a patient with a head injury, what assessment factor will provide you with the most information regarding the patient's condition? I'm going to go with mental status on this one. That is very indicative of what the person is going through. If they are altered at all and they have hit their head, then that's how you know they have some kind of head injury. There are 3 stages of labor, and the second stage of labor pain developed, the cervix becomes dilated, the baby is born, the placenta is expelled. Okay, now I don't think they meant to do this, but there's 2 C's. But I know that in the second stage, the cervix becomes dilated. So this is B, so I'm going to go with B. You are called to assist a 60-year-old female who consists of a severe headache. Upon her telling me smell strong odor of natural gas, what is your first action? The first action of this is to get the patient out of the house and into the ambulance. You don't want them breathing more of that fumes of whatever it is, because natural gas is like you left the oven on or something and you forgot to turn it off, and if it's a burning like a gas stove, then that's gonna hurt your head and possibly knock you unconscious and kill you. You should not suction a patient's airway for more than 15 seconds because let's see, I'm gonna go with the patient will become hypoxic during this time. Yeah, it's like holding your breath for more than 15 seconds, especially when someone is unconscious and they're not breathing on their own. They need to be constantly breathing. When is it most appropriate to clamp and cut the umbilical cord? As soon as the cord starts pulsating? Nope. Before the newborn is staged? Nope. Immediately following delivery of the newborn? Yes. Which of the following are signs of early respiratory distress in infants? Breathing rate of less than 10 minutes, limp to muscle slaps, and a rate decibels, increase rate of breathing. Oh man. I'm gonna go with this one. This one has all of them. Which statement about patient confidentiality is correct? Patients who are cared for in public places lose their right to confidentiality. Wrong. The right to confidentiality does not apply to minors or wards of state. Nope, but that is wrong. The patients have this statement releasing confidentiality. I think this one's right. A patient must sign a release before any confidential information can be disclosed. That's not right because you talk to doctors a lot and like other people that need to know about it. I'm gonna go with this one. This one's right. At the scene of an MCI, who is in charge of the overall scene? The incident commander. The most common electrical rhythm disturbance that results in sudden cardiac arrest is called VTAC. Wait. VTAC. I do not think it's VFib. After arriving at the hospital, you have some blood on your stretcher. The most appropriate way to disinfect the stretcher is... Oh, wow. I'm gonna go with straight bleach solution. I think it's either 1 in 10 or straight bleached, but I'm not too sure. You're treating a patient with a fractured femur. The most appropriate splint to use would be a traction splint. Now, if they said that you need to get out right away, like out of the scene, you would have just splinted to the other leg that's uninjured. Where should you place your hands when using the head tilt chin left maneuver to open an unconscious patient's airway? Nope. On the forehead with the other hand on the neck. On the forehead with the fingertips of the other hand under the lower jaw. Yes. The patient is a 29-year-old female pregnant with her second child. She has 30 experiments and saw bloody show approximately 4 hours ago. Her contractions are 2 minutes apart and lasting 60 seconds. Transport time is approximately 45 seconds. You should supposed to be is either prepare for an imminent on-scene delivery or position the mother on her left side and begin transport, but 45 minutes is a long time. I'm going to prepare for imminent on-scene delivery, which already do typically says on infant. That'd be the brachial artery. The brachial. You are suctioning your patient's airway. One of the biggest side effects of suctioning is hypoxia. You have successfully converted your cardiac respiration out of VFib. I'm going to choose my answer in a second on one of these. With your AD, the patient's pulse respirations are 6 per minute. You should continue to assist the patient with ventilations via BVM and oxygen. VVIP. A 2-year-old male patient is in respiratory failure when he has limp muscle tone and weaker absent distal pulses. The main way kids go into cardiac arrest is because they go into respiratory arrest first. You are treating a patient with shortness of breath. You want to deliver 6 liters per minute of oxygen. You would deliver the fluid with a nasal cannula. Your patient is vomiting large amounts of bright red blood. The patient does not complain of any pain, tenderness, and ailment during your assessment. The patient's pulse is 128 and he's having difficulty breathing. His skin is pale, cool, clammy. You know, he has jaundiced appearance. You would suspect the patient has. He's vomiting. I'm gonna go with pancreatitis. You know what? Honestly, esophageal varices. I'm gonna go with this one. I don't think it's this one. It's not appendicitis. It's benign pancreatitis. But he doesn't complain of any pain or tenderness. Yeah, it has to be esophageal varices. Your patient has been stung by a bee. I need to drink some water. 1 second. I'm so sorry. I did not mean for that loud noise to happen. Your patient has been stung by a bee in the bringer. The stinger is present in the wound. You should remove it by now. This is the one that I feel like most people would get wrong, like just naturally. But you never grab it with tweezers. And you definitely don't use your fingers. You scrape it with a rigid object such as a credit card. You just scrape it off. You are assessing a conscious patient with chest pain, which mnemonic will assist you. And the current chief complaint, you would use OPQRST. Anything with pain is OPQRST. Ligaments connect. Oh, I don't know this one. Ligaments. I'm gonna go bone. No, tendons are bone to bone. I'm gonna go muscle to bone. You arrive to find a 48-year male complaining that his chest feels heavy. The patient is awake and talking to you. During your assessment, you know that his skin is pale, cool, clammy. Your first step is to administer supplemental oxygen. Anything with chest pain and you see that their skin is pale, cool, clammy, like sweaty, give them oxygen. They're probably having a hard time breathing. The production of insulin occurs in the pancreas of the following which body fluid has the most potential to transmit bloodborne diseases. Nasal discharge 100%. That's like your snots, like sneezing and all that kind of stuff. All the following signs may be signs of allergic reaction except. It's between decreased blood pressure and decreased heart rate. Let me think. Decreased heart rate. Your pregnant patient is experiencing contractions. She feels like she's in her bowels. This may indicate that the birth is imminent. Yes, if you ever hear a pregnant lady saying that she's having contractions and that she needs to use the bathroom, be ready because she is going to have the baby. You are sitting with childbirth in the field and the admin said delivered discover that the umbilical cord is wrapped tightly around the neck. You should immediately clamp the cord into place and cut it. I was looking for a different one. Usually when you see that the umbilical cord is wrapped around the neck, you should try and get your fingers underneath the umbilical cord and the neck and try to separate the two, as it will alleviate pressure and you can get the baby out fully, because sometimes you can't get the umbilical cord out around the head. Sometimes. treating has white, waxy skin on both hands. The patient's hands feel as if they're frozen or small, and you notice that the blisters are forming, which is why would you not want to do in caring for the patient. You would not want to remove any jewelry. You are transporting a patient. You are transporting a patient who has been, actually, rub the hands. Let me go rub the hands. You are transporting a patient who has been resuscitated but is still responsive. You should check the patient's pulse every best unresponsive. Okay. I'm gonna go 1 minute. I think it's 1 or 5 minutes. The air sacs and lung where oxygen and carbon dioxide exchange occurs are the alveoli. You arrive on scene of a tanker truck carrying hazardous material. You should position your vehicle. I did not know 2,000 feet. Actually, that makes sense. We're gonna go all of the above on this one. I know it's all of the above. You arrive on the scene of a possible unconscious patient located in a lab setting. On the exterior of the room, there is an NFPA diamond with a 4 in the blue portion of the diamond. This is, wow, I'm gonna say an extreme, the blue portion of the diamond. Extreme water reactivity. I'm gonna go with water in this one because it's blue. A patient complaining of facial paralysis on one side of his face with tearing, localized pain, and sensitivity may be suffering from the most common form of face paralysis called ALS. I'm gonna go with ALS. ALS is either Bell's palsy or ALS. Wait, is this the most common form of facial paralysis? I'm gonna go Bell's palsy. A minute after the baby's born, the heart rate is less than 60 beats per minute. You should begin chest compressions. Yeah, a newborn heart rate should be like 150. It shouldn't be anywhere near where we are. That is a big indicator that the baby is needing our help. Which of the following actions should be carried out during the initial assessment? I'm gonna go with assessing the skin. Seizures in children most often are a result of an abrupt rise in body temperature. You're called to the scene of a possible drowning at a local pool. When you arrive on scene, a bystander is holding the patient at the surface of the water. The patient is unconscious. Your next step is to, when you arrive on scene, a bystander holding the patient at the surface of the water. Remove the patient from the pool. It seems pretty obvious, but it's okay. When treating an eye injury involving an impaled object, it is important to, you want to cover both eyes and stabilize the object. The reason for this is because if one eye moves, then both eyes are going to move, and you don't want something in the other eye moving. So you gotta stabilize the first one and cover both their eyes so that they can't move. Which of the following is the first line of defense in fighting against infectious diseases? We're gonna say using hand washing. Yes, hand washing is always 100%. You are treating a patient who is overdosed on a narcotic. The greatest risk for this patient is respiratory depression or respiratory distress. When you listen to lungs of an asthma patient, you would expect to hear wheezes. You are treating a patient suffering from anaphylactic shock. Which of the symptoms would you likely see in this patient? You would see urticaria, this one, yeah, urticaria, tachycardia, tachypnea, and hypotension. Your patient, a 69-year-old male, is in cardiac arrest. His wife informs you that their physician has written a DNR order for the patient, but she does not have the written order. You should provide all necessary care to save the patient's life. Yeah, this is a huge thing. If someone tells you that they have a DNR but they do not have it, you keep going with your life-saving measures. You do not stop unless you see the DNR and it has been signed by a physician and it is a correct DNR. in an MCI, which patient would be assigned the highest priority? Inadequate breathing, unresponsive to suspected internal breathing, yes, 100%. Yeah, this 100%. Out of this one, well, this one, the main thing they look for in MCIs, like big car crashes, is that if you find someone and you find like an adult and they have no pulse and they're not breathing, you immediately just kind of have to tag them dead. You can't really do anything for them. Your patient has what appears to be a dislocated shoulder. I'm gonna go with this one because it says inadequate, not all the way. No, he's not breathing. He's breathing, but it's bad. Your patient appears to be a dislocated shoulder. Treatment for this would be swing and swab the injured shoulder. Your patient has profuse bleeding from a wound on her lower leg, but no signs of skeletal injury. The injury, the steps you take to stop the bleeding in the correct order are direct pressure, elevation, pressure dressing, and pressure point. Pressure point. Okay, what? This one. Which of the following is the most common cause of suicide? Suicide. Depression. You can assess a pregnant woman in uterine contractions by placing your gloved hand on the lower abdomen below the navel. When establishing lines of a medical object, the minimum area should be 100 by 100. You can do it with like 75 by 75, but minimum should be 100 by 100. The process of losing air through direct contact is called conduction. Which rhythm often converts to ventricular fibrillation. VTAC. The reason to position a pregnant woman on the left side is to show this. Go with that one. What is the best method to assess circulation in infant? I'm going to observe a cat refill time. You arrive on scene to discover a patient who refuses to allow you to touch her. You feel the patient is in need in treatment and attempt to take her blood pressure. You have just committed. I'm gonna go with assault. This one definitely counts as assault. You arrive on scene to find an unconscious patient about 14 years of age. Why would you assess the pulse on this patient? Carotid. Bacterium addresses the incubation period of 11 to 21 days. Which situation requires an emergency patient be moved? Patient not patient bed. Which situation requires an emergency patient be moved? This one, 100%. As someone's going undergoing cardiac arrest and this thing ain't chair, you can't do CPR, so you need to get them to lay down on their back. You never approach a helicopter from the well, it's usually the front or the rear. You never approach from either of these. I'm gonna go with the rear. A 45-year-old male was involved in an MVA. The patient is short and suppressed. The patient is complaining of shortness of breath and chest pain. You recognize the patient's JVD and the patient's pulse is weak and thready. You believe that the patient has pericarditis tamponade. You distinguish that this is a problem with the patient by nothing or discovering decreased heart sounds. Your patient, during her assessment, you find a possible fractured leg and hear the bones grinding together. This is called crepitus. The head of a newborn has just been delivered. You should suction the baby's mouth and nostrils. You arrive on scene to find a patient who has productive cough for the past 2 weeks. The patient is complaining of fever and night sweats. Your next symptom should be to, put a mask on. That is a very following is not an imminent sign that birthing is going to occur? Patient adamant, it's very hard. Which of the following heat emergencies are considered a true emergency? Heat stroke. Which of the following is a sign of inadequate breathing? No audible sounds. Accessory muscle use. Okay, so this is a tricky question. It can trick you if you don't read it correctly. When you hear no audible sounds, they mean like your lungs are clear, right? So when I'm breathing, you're not hearing any high-pitched noises, you're not hearing any wheezing, you're not hearing any stridor. That's what they mean. Accessory muscle use is definitely a sign of inadequate breathing. If you are not breathing correctly and you see someone's neck kind of light up and like their shoulders and their chest are lighting up with all their muscles, trying their best just to get a breath in, that's bad. You do not want that. Which of the following is true regarding of using a pocket mask to ventilate a non-breathing patient? There is direct contact between the rescue and the patient's mouth. A one-way valve prevents exhaled air from contacting the rescuer. You are treating a patient who has been involved in a motor vehicle accident. You can lift the flap of the skin on the patient's head. This type of injury would be known as 1 second. The puncture is created by this is 100% in avulsion. Firefighters have rescued a man from burning, his house burning, from his burning house. His conscious and considerably respiratory distress. Yes, a brassy cough and cinched nasal air is the most immediate threat to the patient's life. Is closure of the airway. I'm going to say right now. I would say if he had, it's not saying anywhere in the question that he has severe burns, but you can live with that most of the time. So what we're gonna do is considerably respiratory. Closure of the airway. They said respiratory distress. I'm gonna go with closure of the airway. All right. Which patient should receive a rapid trauma survey to determine hidden injuries? An alert 2-year-old who is in a medium speaker now. Alert 20-year-old who fell 10 feet away, late pain no. Is 65-year-old who fell in the wrist. Hidden injuries. Honestly, I think this one right here. Oh. An 11-year-old who tripped while roller skating and fell down 3 steps. An alert 65-year-old fell in the bathtub and putting a wrist pain. This one's a little bit hard, I'm not gonna lie, guys. I think so. You want to think of something. Where would someone get the most amount of injuries? Okay, I'm gonna go with this one. Old people falling is an immediate sign of like you want to get them checked out, make sure that they don't have anything else. Especially as they get older, they'll be like above like 62 and above. Just get really brittle. You arrive on the scene of a patient who fell from a ladder. You should open the patient's airway using a jaw thrust maneuver. Yeah, anyone who's had any kind of head injury, do not use the head tilt, the chin lift, or use a jaw thrust. In legal terms, a tort is... I have no idea what this is. I'm guessing. You are treating a 35-year-old patient, a 35-year-old conscious choking from the patient suddenly goes unresponsive. Your next step is to perform deliberate abdominal thrust. Honestly, it really should be CPR or ventilate. Go with whatever I just put. All the following are signs of possible child abuse except severe traumatic event that occurred for no reason. Looking out for child abuse is one of the main things that we are told so much in the EMT school. They always tell you just to be aware, and don't be a detective, but just look and observe. And if you have to question the child when you are treating them on their own with the parents or someone who could be hurting the child separately. A soft tissue injury that results in a flap of torn skin is referred to as an avulsion. When treating children, all the following are important considerations except yeah, that should be a given. You treat them like they're adults. You talk the same way we would. Sometimes you just have to be a little bit nicer. A 23-year-old patient female is bleeding profusely from her vagina. All the following actions are appropriate except placing a sanitary napkin in the vagina. Do not place anything in the vagina. Please do not do that. You arrive on the scene of an incident where a 12-year-old male fell from approximately 12 feet. That would be considered a significant mechanism of injury. Which of the following would most likely cause flushed skin? Hypoxia. Select a grass size or for a small child by measuring from the corner of patient mouth to buck structure from the pinna of the ear. Yes. During your assessment of a patient's chest, note that the left side of the chest moves opposite to the right. This is called paradoxical movement. If a person was hit by an object described in the following, which of the following? If a person was hit by an object described in the following, which would have the potential to cause the most damage? Honestly, I think the speed is really what's going to determine something. So I'm going to say one man object traveling at 30 miles an hour. Which of the following is not true? Not true. The achievement of an impaled object from blocking the airway. That's true. Control the bleeding. Yes. Okay, remove to accommodate transport of the patient. Yeah, that's don't do that. Vitreous humor is found. Oh, hold on, wait. It's not these two. Behind the lens, in front of the lens. It's in front of the lens. What is the primary action of nitroglycerin? And it is to dilate the coronary arteries. Patients commonly describe heart attack pain as one of the following characteristics. Intermittent. A sign or symptom of a pre-delivery emergency is the presence of aplasia. Your patient is an 84-year-old female having difficulty breathing. Her daughter, age 45, is with her. When communicating with the patient, you should assume competent and able to understand and speak respectfully. Yeah, you never want to assume anything about old people because that can really agitate them and you can lose rapport, as you could say. A 20-year-old patient was sexually assaulted. The patient states that she is hemorrhaging profusely from her vagina. You should apply a sterile sanitary napkin. Yeah, usually what you want to do is you just want to cover up the vagina with some kind of sanitary pad, and you obviously have them remove their pants and you just transport them. You don't do anything out of the ordinary that you would normally do, and you always explain all of what you're going to do to the patient and let them know that you're here to help them and you're not doing anything out of the ordinary, and that what you're doing is for the patient's health and safety. A 34-year-old woman who is 36 weeks pregnant is having a seizure. After you protect her airway and ensure adequate ventilation, you should transport her on your left side, always not on the left side. A 4 to 5 year old male is just experiencing chest discomfort after placing him in a position of comfort. Your next action should be to manage oxygen by nasal cannula at 6 liters a minute. Your patient is a 25-year-old female who is severely hypothermic after having plunged into an icy river. Although she was rescued after only a few minutes in the water, she is showing diminished level of responsiveness. Your care should be covering the patient in blankets, turning up the heat in the ambulance. Yes, of course. Always, 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 always. Now the next one is immediately upon delivering newborn's head, you should first suction the nose. And pedestrian versus automobile impacts, which of the following statements are true. 1 second, I am texting back my girlfriend really fast. 1 second, 1 second, 1 second, 1 second, 1 second, 1 second. 1 second, 1 second. 1 second. Okay, which of the following statements are true? Adults then turn towards the vehicle before impact. Children often towards impact and are often scooped down. Third, turn towards impact are thrown down under the vehicle. I'm gonna say children are thrown over the vehicle more than often. Or actually, there's a difference. You are treating a patient with frostbite. Which of the following actions should be taken? Apply direct heat to remove any fluid from the affected limb. There are hollow and hollow organs in the abdomen. The gallbladder is considered a hollow organ. A ruptured hollow organ such as the gallbladder is most commonly associated with inflammation and infection. Storing respirations are most rapidly managed by correctly positioning the head. I think this one's wrong. I honestly think this one should be inserting an OPA. But I guess if you were to fix their head and position it the right way, then maybe they wouldn't be trying to swallow their own tongue. You are called to the home of a 20-year-old male who is depressed. The patient states he's going to kill himself. Your first step in training this patient is to, say that. Yeah, honestly, you're gonna have to give this one over to the police. Unless I'm just gonna say restrain the patient. Sometimes you are allowed to, but you should really let that be handled by the cops. I mean, if you're already there, then I would just you want to talk them down, but you don't want to be rude. Like this one, asking them how they're gonna do it is only gonna make them want to do it more. So I'm just gonna, it's either restrain the patient to prevent him from hurting himself, or it's turn the scene over to law enforcement. It's one of those two. Which of the following situations may an EMT place their hands in a patient's vagina to relieve pressure on a prolapse cord? Yep. A 29-year-old male is taking LSD. The patient appears very anxious and in panic state. He is showing signs of paranoia. You should talk the patient down by reassuring the patient. You are evidencing to find an unresponsive female who is in her car in the garage. The car is running and the door is closed. Look into the outside window. Your next action would be open the large garage door. Oh yeah, for sure. And then you definitely want to shut off the car also. You arrive at an emergency room to find the nurses are busy taking care of other patients. You are getting off shift and want to get back to the station. You and your partner should remove the patient into a hospital bed, lay the report on the patient, and leave. You and your partner have just committed abandonment. Yeah, never do that. What is the first thing you should do after receiving orders from medical instruction physician. Repeat the order exactly as you heard it. In addition to caring for injuries, emergency care for a rape victim should focus on which of the following. Performing a pelvic or rectal exam of the patient. Preserving evidence in a paper bag and restripping so whenever you deal with a rape victim, if they want to remove their clothes, or if you can, you always put it in a paper bag, because plastic bags tend to I forgot the reasoning why they said paper bags, but you always want to put it in a paper bag, and you want to preserve the evidence, because it's going to help catch their victim if the victim is not there, or just help bring someone to justice. And then you always want to make sure that you're reassuring them, and that you're trying to do your best to help them out. Your patient has blood, your unconscious patient has blood in his airway. You should use a suction unit to immediately clear the airway. To which patient would you administer oral glucose? 6-year-old female behavior station oxygen and his daughter informs you that she takes insulin by injection. A 45-year-old male, not that one. 7-year-old male with a long history of diabetes, unconscious and cannot swallow. 52-year-old man who's feeling dizzy and low blood sugar. This one. You arrive unseen to discover a 6-5-year-old male lying on the female lying on the floor of her living room chair. Your first step to care for the patient is to assess the level of consciousness. The electrical impulse generated in the right atrium is called the SA node. Emergency care for response of a 7-year-old child with a foreign body airway obstruction. Includes seen by the child. Please note this one. You are called to a store where all the has been committed. Police are already on scene, searching for the gunman. Through a window, you see a store manager who has been shot. You should wait until police tell you it's safe to enter the scene. The scene size up includes all the following components, except assessing the need for assistance. Wait 1 second. Wrong one. Evaluate the mechanism of injury. In which of the following situations would you call for immediate assistance? You care for 2 critical patients with gunshot wounds. That sounds pretty good. Yes. Which of the following is not a risk for a stroke? Okay, so these 2 are definitely risk for stroke. That one is definitely risk for stroke. If you have uncontrolled high blood pressure, then you could rupture an artery in your brain and you can cause a hemorrhagic stroke, which is one of the 2 types of strokes that mainly happens, which is ischemia or hemorrhagic. Hemorrhagic is very fatal. It's like a 20% chance to live. The focus history for patients with altered mental status should include questions about following trauma, diabetes, teacher, and which of the following? Altered mental status. Fever. A sign of generalized cold emergency or hypothermia is cool skin on the honestly, I'm gonna go with feet or hands. That's the first place that's gonna feel hypothermia. To assess the motor function, the lower extremities of responsive patient, you want to motor. Ask the patient to wiggle their toes. Yep. You have just I dropped my phone. You have just assisted in delivering an infant with pink body, a pulse of 106 per minute, and good muscle tone. Infant is crying lustily. How would you care for this newborn? Wrap it in clean towels and give it the mother to aspirin. Okay, monitor for 1 minute, reassess vitals. Okay, so the only thing that going to mark. I'm gonna go with C. Emergency care for an infant when meconium is present in the amniotic fluid is suctioning and notifying the hospital the meconium was present. Which of the following is the highest priority patient? We're gonna go with a 57-year-old male with chest pain and systolic blood pressure of 80. 40-year-old female with moderate pain from a leg injury. No. 75. No. 25-year-old female in labor with contraction and support. 80. Yeah, this one for sure. That's really low blood pressure. AD is used to treat patients in VBIB. You are the triage officer at the scene of a mass casualty incident. Which of the following patients should be treated first? No. Not breathing. An 80-year-old patient is conscious but is having trouble breathing. This one. Ethics is best described as the principal's conduct is not sure what is right, wrong, good, or bad. Which of the following situations represents your abandonment of a patient? Begin assessing the patient, but turn responsibility for the patient over to a first responder. You begin CPR and cardiac arrest, but stop. No, you refuse to help a patient with the approved medical attention. You do not. You begin assessing a patient, but turn responsibility for that patient over to a first responder. Yeah, I'm going to use this one. Which of the following is a late sign of shock? Late sign. Decreasing blood pressure. But it's really, really low, then yeah, it's a late sign. So, that's something that you want to be aware of when it comes to that kind of stuff. Alright, immediately after delivering a shock with a patient with AD to a patient in cardiac arrest, you should continue. You should continue doing CPR. Always. Which of the following would findings be most significant during assessment of a patient with a severe headache? Unilateral weakness. Yeah, that's a big sign. You are the first on scene of an MCI incident. Your responsibility is to begin triaging the patients 100%. Which patient can safely receive only a focused physical examination rather than a rapid trauma assessment? A 10-year-old male with a former leg response after falling off his bike. No. A 20-year-old male complains of severe chest pain. Severe after stepping off the curb. A 7-year-old male complains of neck pain after medium. Yeah. And you go this one. You want to do a focus one. You want to do on like someone who's alive, I should say, or conscious and medium speed car collision. That's like 30 to like 50 miles an hour. I think 50 is like high speed actually. That can really hurt someone. Which of the following is not part of history or secondary exam? Form a general question of the patient. You do that as you're walking up. Your patient is behaving abnormally but refuses treatment after falling down a flight of stairs before transporting the patient without consent. Your patient is behaving abnormally but refuses treatment after falling down a flight of stairs before transporting without consent. You should document the presence of any injury. Contact medical direction for advice. Yes. You arrive on scene finding an unconscious patient. There are no other individuals in the vicinity to give any other information or permission to treat the patient. Even though the patient can't give consent to treat him, you do so because of implied consent. Which of the following is not considered a significant MOI of an adult? False. Greater than 10 feet. Yeah, anything more than 20 feet is a significant MOI. EMTs should wear high efficiency particulate air respirators when they are in contact with patients. So which of the following? Hepatitis B. Yes. Actually, wait. Tuberculosis. I think. If it's active tuberculosis, it's between one of these two. Which of the following indicates that a patient with hyperthermia is in serious danger? hot skin. Pink or bloody sputum is often the same with pulmonary edema. Yes, it's also CHF as well. You have just intubated a patient in cardiac arrest. Your partner tells you he hears presence on the right side, but at the left, you should suspect. Intubated in the left stem bronchus. Intubate the right stem bronchus. You're in the esophagus. So you would have intubated in the right side because you didn't get him in the trachea. I'm assuming your patient has experienced a spontaneous abortion or miscarriage. You should treat the patient for shock. See, I don't know. Remove any tissues from the vagina. Don't do that. Don't do anything in the vagina. Following an explosion, a patient is trapped in a collapsed structure and suffers crush injuries to both lower extremities. How would the injuries be classified in the blast injury phase? This is your tertiary. Under medical direction, the EMT basically may administer epinephrine to a patient with respiratory distress or hypoperfusion resulting from an allergic reaction if the patient is in severe respiratory distress or arrest. Your patient is a 6-year-old female, fell off her bike. She has suspected broken ankle, no respiratory compromise, and no suspected internal injuries. After providing necessary care at the scene, you are transporting the child and her father to the hospital. The father loudly insists that you use lights and sirens en route. You should. Yeah, I'm just gonna say refuse, mainly because that you use lights and sirens when you have like a high priority patient. But I don't know about this one. Honestly, I'm just gonna say this one, but I'm gonna go back and double check that. Which of the following are signs of shock in early stages? You want cool, clammy skin. There we go, that first one. The appropriate care for a patient with epistaxis is to lay down. Oh, this is a nosebleed. Lean forward. Which of the following pressures is considered narrowed? What? 20. Which statement about a patient's right to refuse care is correct? A child will understand teachers will not to refuse care. No one can. An adult patient who is sound of mind understands the context. Yes. Albuterol is a medication administered by inhalation. When arriving at the scene of a possible hazardous mass materials incident, you would identify Hender's by thoroughly. Nope. Interviewing victims and bystanders. The golden hour emergency versus the first 60 minutes after. Arrival of EMS. Your patient is an 11-month-old female. How can you determine if she has decreased mental status and is responsive to verbal stimuli? You will be unable to tell how old she is if you ask her. You will attempt to locate her parents' voice when they speak. She will try to pull every painful stimulus on her toe. The head of volume is best described on the volume of air inhaled on a single breath. Your patient is an 8-year-old female who had a single brief seizure at school. Her mother has a time on you do and reports that her daughter has been seizures often and is on medical treatment. What should you do? I would maintain ABCs, monitor vital signs, and transport the patient immediately. When you grab a backboard, you realize that blood stains from an earlier call. With your hand covered in blood, your first step toward decontamination is washing your hands with soap water. You are called to assist a scuba diver who is having trouble breathing. patient said that it started 15 minutes after she surfaced. She complains of chest pain, dizziness, blurred vision, nausea, and vomiting. The patient is most likely suffering from decompression. Decompression sickness. You are assessing a 24-year-old male who was involved in a bar room brawl. Witnesses say that the patient was struck with a bar stool. The patient unresponsive. Battle signs on your assessment. This is a sign of intracranial bleeding. The patient is bleeding severely from the lower leg. You have applied direct pressure and elevated the leg. Your next step is to apply tourniquet. Approach to the following procedure. Would you wear gloves, gown, mask, and protective eyewear? You would do this when bleeding control is burning blood. Which of the following this one. Which one performed the modified jaw thrust maneuver to open your patient's airway? Which of the following steps is not correct? Lift the head by applying general pressure in front. Use your index finger to push. Use your elbows on the same surface. Tilt the head by. Not that one. The most serious side effect of alcohol consumption is liver damage. I would say death, but are you really gonna die? And say excessive alcohol consumption. You're treating a 62-year-old female patient who's complaining of shortness of breath, chest pain, and coughing out frothy sputum. You should suspect. Oh, you gotta be kidding me! It's CHFs on the left side. When assessing a 35-year-old patient complaining she has shorter breath, that her breathing is excessive 28 times per minute. This is considered tachypnea. Which of the following arrhythmias would be shot using an AED? BTAC. When splitting an uninjured limb, you should assess pulse, motor function, and sensation distal to the injury before and after applying the splint. I'm ready to submit my dose. Where's my scope questions at? The patient is large. This one. Here we go. Let's see. I'm thinking above a 70. Oh, what? Really? I think I had 69%. Wow. Okay. Whoops, I guess that was my bad. Okay. Oh my god, literally said the most serious right here. I'm an idiot. Wow, I can't believe I got 60%, guys. Well, listen, I gotta study up some more. I'm setting up the rest of today, and then I'm going to probably study up. I'm setting up today at night, so wish me luck tomorrow. On my NREMT, I am very, very excited to go, and it's gonna be a great time. And everyone, thank you so much for watching my video. I really hope you guys enjoy. Okay, first of all, this one should have been right. I got 70% on this, guys. This one should have been right. Alright. Everyone, thank you so much. Everyone has a great day. Thank you so much for watching my videos. If you really like it, please comment, like, or subscribe. That would really help my channel. But without that, thank you guys so much. And I hope everyone has a great rest of your day. Thank you so much.